Hey, welcome back. Today we're here with Daryl Morales.
Hey, doing friends?
Koinonia. He works for the CRC, Crisis Resolution Center here in Loomis, California. And we've been talking about how not to hate your kids during COVID. That is our theme. We are here to help you. And we have this amazing program here in Loomis that's been going on for, it's been 10 or 15 years.
Yeah, we're heading up on 20 years.
It's the best kept secret.
It really is.
It's an amazing program, and it's specific to helping people in crisis, helping families, helping parents. So, Daryl, tell us about the CRC. What do you guys do?
So, CRC, like we said, has been in the Loomis community, Placer County, for coming up on last 20 years. We are a 6-bed co-ed facility where it's a home environment. We really want to do our best to allow youth, when they're coming into our program, to get regulated as soon as we possibly can. All services are no cost to our Placer County families. We've got a lot of great supports that we can connect the family to. The many things it is that we have an opportunity to offer families with is creating family plans with new expectations. So there's a lot of supports that the CRC can offer with in creating family plans to address disruptive behavior, self-regulation tools to when the A, B, and C is on. Do we go with that feeling? Or what do we do to self-regulate? We can also do some short-term counseling as well, meeting the families where they are, even getting some referrals to our Placer County community-based organizations as well. So we do a little bit of everything, and we're here to support you wherever it is that we can.
So are the kids foster kids, or are they...
You know, the kids are all of our kids. We definitely have some criteria. Definitely have to be a Placer County family. No a youth that have been adopted, but foster care, we could definitely help. So some of our foster care families, we're here to support you wherever it is that we can. The main ages that we work with are between the ages of 12 and 17, at least for the residential portion. But for the ancillary and doing some family meetings and some parent educations, I've met with youth that are as young as 11 years old, that preemptive strike before we kind of get a little bit older, and some other disruptive behaviors as well.
Yeah, this is a unique program. I've never heard of any other type of group home like this.
It's nowhere around. I mean, working in Sacramento County as well, there's really nothing like the Crisis Resolution Center. And though we've had other counties come out and try and replicate, we've got this dialed. So let us know how we can.
So if you're from another county and you're watching this, I mean, feel free to give us a call. We can give you some ideas on how to do this. But it's about preventions. Yeah. It's about family. It's about keeping families together, which is what I believe the state and the federal government. That's where they're going. They want to keep families intact. They want to use foster care and group homes as kind of a prevention tool, or the way to get kids quickly back to their families. Maybe they have to leave their family short term. Maybe it's the CRC. Maybe it's foster care. But our goal is to get families back to being whole.
Agreed.
Get kids home. And his program is so amazing at that. Yeah. Now, you talked about the ABCs. What did that stand for?
Well, before we even get there, Bill, I really want to kind of go back to what it is that you were just talking about. One of the big things that Bill was just talking about was in regards to the reunification. That's everything that we do at the CRC. Our primary goal is to work that out with the family. So a youth may come into the CRC. We want to give a little bit of separation time, allow some of that dust to settle. We start having family meetings. Youth start doing incremental passes back home, 24, 48, 72 hours. When a youth can be away from the CRC for 72 hours, we know that that's right around that time. But during that period of time, we're having family meetings. We're doing parent education meetings, because it's one thing for the youth to come into the CRC program and get all these tools. We need to do the same thing for the parents, because we would just be sending them right back into the same setting without any new tools. And we just can't do that. Mm-hmm. So that is a really big service approach piece that we address along the way. Now, one of the things it is that you probably saw me say a little bit earlier is that A, B, and C, when that happens, what do? So I have this mindset with A, B, and C, and I'm sure a lot of you parents know exactly what it is I'm talking about. Whether it is you see that A, B, and C in your youth or even in ourselves. We just saw our youth do something. It's like, I've never seen them say or do something. What do I do? The A, B, and C starts. A, B, and C. Attitudes, behaviors, and choices. Not just from our youth, but some of the choices that we make too as well.
No, not the parents.
Well, we don't do that. No, not even us as grandparents as well. But we know that it happens, right? It does, right? Yeah. So when the A, B, and C happens, what's our X, Y, and Z? Do we just, when we're feeling angry, do we just go along with the feeling? Da, da, da? Or do we use something to help regulate? And I don't know if a lot of you just heard just what happened in my tone and volume. It completely changed. I went from a presenting voice or an assertive voice to a tone of empathy. And so just know something. If there's anything that anybody hears watching this video, what it is that I want you to hear is that every time when we speak in the tone of empathy, soft tone, low volume, the brain can't help itself. Literally what it does, it forces the brain into thinking listening mode every single time. Think about how it is that we would like to be talked to with compassion and understanding. And when I'm in meetings and with youth, I tell them I could even prove it to you. So would we rather have the rest of the meeting sound like where we're talking in the tone of empathy? Or would you rather have me talking like this for the rest of the meeting? It's really easy. The one thing, just know, you try this with your youth, and the first thing that's going to happen, they're going to look at you like, what'd you do with my parent?
Yeah.
I also try and inform you that when we hear this tone of empathy, it's not about the parent being weak. What it is that we're trying to make that connection. And that's what that tone of empathy is all about. So I ask parents, and I ask youth as well, use the tone of empathy, especially when you don't want to.
Yeah.
And we can all relate.
Yeah.
So there's some tool.
Take a time out. Take a break.
Do whatever it is you need to do. But we have this phrase that we use at the CRC. The moment that the parent or the staff sees that, did you just hear my voice change again? I just went from my presenting back to the tone of empathy. That every time when we see that behavior, there's a phrase that we use, but it has to be used with a big giant dollop of empathy. Soft tone, low volume. And this is the phrase, I see the behavior. Are you sure you want to be doing this right now? It's a question.
So you're giving the kid a chance to...
And a choice.
Maybe, a choice
and
to
a choice.
Switch it up. Yeah.
Because who can I control? Only me.
So what happens if I yell and I get angry at the kid? Then what happens?
Brain shuts down for the youth. They cannot hear our message. Because remember, the tone of empathy opens the mind to thinking and listening, but a loud tone, loud voice shuts the brain down. Cannot hear the message. Cannot hear the message.
Well, now we work with children whose brains have possibly been compromised due to drugs or alcohol or abuse and trauma. And so those brains are working even a little bit differently. Yeah. Now, I'm not saying that's your child, but we do here at Koinonia work with children that have been from hard places. And those brains actually need even more compassion, more love. You know, it always starts with regulation first, staying calm, staying connected, and then you give your message. I like that it's slow, compassionate. I like that voice of empathy or tone of empathy to give the child a signal that I care. I have to correct you, but I care in doing that. And so Daryl works with a lot of families in crisis, a lot of kids in crisis. Thank you so much for that nugget.
Yeah, no worries at all.
We're going to be coming back with more nuggets because we want to help you not hate your kids or your spouse during this time of COVID, okay? So like us, subscribe to us here on the YouTube channel.
Yes.
And then keep an eye out. We're going to have more from Daryl over at the CRC, but we will see you next time. Thank you so much, Daryl.
You're more than welcome. Thank you for the opportunity. Happy Friday. Take care, friends.